hypertension are highly susceptible to COVID-19. Doctors say those with such conditions are more likely to contract COVID-19 since their immune systems are down and are advised to take more caution and adhere to the COVID-19 protective measures.
Dr. Roslyn Ngoge, a diabetologist, says access to diabetes medication in most hospitals has become a struggle and urges people to take precaution by keeping their blood sugars regulated to avoid more cases of diabetes in the country.
We have adequate amount of insulin, the right type of insulin. I can honestly say we do not. Then when we come to the different types of drugs, the antivirals, what I have access to in a private, I do not in this public.
Following the recent scarcity of beds in hospitals due to increased COVID-19 cases, Roslyn urges those who are diabetic to be extra cautious.
Now, do we have the bed capacity to be able to handle if all diabetics were to be admitted? We do not. The likelihood of you requiring oxygen is very high, and we do not have adequate amount of oxygen.
Peter Ngatia, a clinical officer, advises on healthy living for all people as a way to prevent diabetes contraction. Ngatia also urges diabetics to move to more advanced and affordable treatment in order to regulate the severity of the illness.
But one of the key factors would the people manage your sugars, keep your sugars to optimal, bring blood pressures down, weight down, and also we bring the cholesterol down.
Newton Ngoge, a diabetic and counselor at the Kenya Defeat Diabetes, says living with the disease is challenging more so as to these times of the coronavirus pandemic.
Especially during the COVID season, we have faced challenges, especially people living with diabetes, whereby in terms of a supply of our medication, there has been an erratic supply, whereby it is in and out of stock. There has also been changes in the socioeconomic spectrum, whereby some of the members of KDD, also people like me also, have got a situation of losing maybe their source of livelihood. So in that situation, it has impacted the management of the condition.
Reporting for Channel 1 News, I'm Wamboi Otiende.